They say motherhood is a journey, but let's be honest, sometimes it feels more like a roller coaster with no seatbelt. I bet you're like me, wondering why babies, or teens in my case, don't come with instruction manuals. Welcome to This Incredible Mom Life, the podcast that celebrates the beautiful chaos, quiet wins, messy moments, and everyday miracles of being a mom. I'm your host, Dummy, wellness coach, mom of 3 boys, and a passionate believer that you don't have to live at the mercy of PMS, burnout, or exhaustion. Join me every week as we hear the craziest and most unbelievable mom stories. I'll be sharing the huge accomplishments and triumphs of both our moms and their kids. We'll giggle, cheer on the kids, and discuss obstacles and lessons learned along the way. If you are struggling to be the best mom you can be, how open-minded are you to booking a free call with me? You don't have to live at the mercy of your cycle, and you definitely don't have to do it alone. Give yourself permission to let me be part of your support system. I believe that you weren't meant to just survive motherhood. You were meant to thrive in it. Behind every superwoman is a story of grit, growth, and real-life challenges. And today we're diving into all of it. Dr. Sidhu is a family and lifestyle medicine physician with nearly 2 decades of experience and someone who recently made the leap from employed physician to entrepreneur, founding Spring Monarch Primary Care, a direct primary care practice. Driven by passion for getting to the root cause of illness and helping people truly feel better, she brings the same philosophy to her work as an assistant clinical professor.
Okay.
Dr. Sidhu was also recently featured on MSN.com in Top 10 Women Leading with Purpose and Passion. Today, she's here to share what's possible when medicine is practiced on your own terms. Thank you, Dr. Sidhu, for being here with me today.
Thank you, Amy, for having me. I'm so excited to be here to talk about this.
Yes, this is going to be a very important topic, and it's new for my audience because we haven't talked about it yet. But first, we're going to find out who you are a mom to.
I am a mom to 3 kids. I have a 16-year-old daughter and then 2 boys, 14 and 8. So we cover all the ranges and all the seasons of life right here in one. And it's just a lot of fun.
Yeah, very similar to me. I have 3 boys, but 16, 14, and 12. So we're in that starting to look at college phase. I'm sure you are too.
Yeah, for sure.
All right. Well, tell us a story about your kids.
So, the story I thought about was really going back to this whole transition of life thing, right? So when the kids are younger, sometimes, and you're starting your career, you're just going, and you're afraid to pause on either side because you just are always trying to prove your worth in both arenas. And sometimes those priorities kind of get muddled. And so when I was trying to decide whether I wanted to stay in my corporate job or leave, my daughter was a freshman in high school. And I thought, this thought hit me one day, like very close to the end, shortly before I resigned. I wanted to stay for emotional reasons, for my patients, emotional connection. I had 2 amazing women I worked with. I had a work family that was just, we celebrated holidays together. There was just deep, deep connections there. And then also a steady paycheck. Also, I thought I was going to retire there. I had never owned a business, like all the reasons that people are scared to leave. And a thought hit me that said, she's a freshman in high school. This is a 3-year contract renewal. If I renew the contract and stay here, hopefully things will get better, right? But if they don't, then I've lost those 3 years with her, right? But if I don't sign the contract, I can spend 3 years with her and hopefully build a business of my own. And I had never had that level of clarity in terms of career versus children. Yeah, I mean, I'd chosen my kids over my career in many ways, in the big ways, but never to stop and think like the future. Like I've got 3 summers with her. And it was just a moment of clarity that I really needed. And it just almost became just an easy decision after that. And it was easy to tell my patients that reason. A lot of them are older than me and they've raised kids. They're like, go, honey, go. It was easy for my partners to understand. So that was a really proud moment for me, because as a career woman, we rarely find a way to pause and think in that way.
Yeah. And such an important life lesson, right? So many people don't do that and they're just working and working. I know moms who have missed like school concerts and um all you have to cut your vacation short because you didn't get enough time off and all these issues. So I'm really glad that you took that step. I feel the same way. I was a stay-at-home mom for many years when I had my kids. And then when I did go back to work, I don't know, I didn't feel happy. It was only part-time. Like the job was perfect. I loved it. I loved the people. I loved where I worked, but I was just going to work for a paycheck. So I did the same thing. I started working from home. So now I'm at least able to, be with my kids. Yeah, mine's not quite driving yet, so I'm still playing taxi driver and all these things, but I'm cooking for them. We do all the, activities,
Mhm.
this and that. So really great that you were able to figure that out. I love that moment of clarity that you had, and I'm glad that you're getting time to spend time with your kids now.
Thank you. I think if she was in junior high, I'd probably still be employed because I wouldn't have had a reason bigger than me to quit, you know.
Yeah, yeah. And I think so many women might even have a reason and they don't quit and they're just stuck and they feel kind of, like, how do I manage everything? So it is possible. If you
I
want to
was
change it,
managed,
it's
yeah,
possible.
I was managing for 15 years, but the job, it was more flexible. And also, my kids weren't as old. And also, now in your 40s, for some reason, we just tolerate less
Yeah,
BS, you know? And so, like, it was like accumulation of just multiple things. And what I figured out is people can help you raise your babies, but they can't help you raise your teens. And we've
yeah,
had the same nanny who comes only 2 hours now from the time my daughter was 18 months and now my daughter's 16, and she's wonderful, but she can't do the things that I need to do for my teen. And so that was another moment of clarity. Like, she was wonderful when they were little and she's still wonderful, but she can't raise my teenagers. I
yeah,
need to be there more.
yeah. And that creates such a bond, right? For when they
Mhm.
do go off to college and they have challenges and they'll
I hope
call
so.
you because they have that relationship with you. So,
I hope so.
yeah, so that's really great. I love it. Now tell us a little bit about who you are professionally.
So I'm Dr. Anu Sidhu. I am a family practice and a lifestyle medicine doctor. I have been practicing for almost 20 years. All of that time, I was in a corporate healthcare system, and I loved my job very, very, very much. I had these amazing women I worked with, and so we were kind of insulated from the changes because we were just such a strong team. But the last, 3, 4 years have just been impossible to ignore the changes that are happening in the healthcare system as panel sizes grow larger. We move through patients faster, more checks and points and clicks, and insurance companies just really running the show. And I became really dissatisfied with myself at the end of the day. When I would go to bed at night, I would think, did I do the right thing? Did I do enough? Did I miss something? And so I just decided, as contract renewal came up, that I would not negotiate out of fear. So I spent the summer exploring my options and I found direct care. So when I finally got the courage to resign, I decided to open my own direct care practice. So I opened that last July, and then I took over another practice in December. So I feel like I'm moving at the speed of light, but yet softer light than I ever have. So it's an interesting, parallel. But I love to address the root cause. I love to help people feel better. I believe in medications and I can write medicines till the sun goes down, but I don't necessarily want to do that. And I believe in Eastern medicine. I believe it's been around for 2,000 years and there has to be some validity to it. And I think that a good practitioner knows how to integrate both, right? So I worry about the, wellness influencer who says, do this for all the cancer treatment and don't do modern medicine. I worry about the modern medicine doctor who says, don't even look at Eastern medicine. So I like to sort of be in there and integrate and really help people feel better with every tool we have, because why not?
Yeah, I love that. And I do the same. I love that I have the medical knowledge and the wellness knowledge. And, it works when you combine it, it's just so much better.
Mm-hmm. And safer when you
Yeah,
combine it.
yeah.
Yeah.
And there's so many more options, right? Like, just to give you an example, like I couldn't take birth control pills for my symptoms. So I had to find alternatives with my lifestyle changes, right? So I'm sure there's people out there who can't have one or the other or don't want one or the other, but the combination of both is often the best.
Mhm.
And today, our topic is going to be PCOS. So, can you first just tell us what PCOS is?
Yes. PCOS is polycystic ovarian syndrome. It is essentially when a woman's body makes too many male hormones that causes irregular cycles. But in my opinion, we need to completely change the name of PCOS because the criteria for diagnosis for PCOS is something called the Rotterdam criteria. And you have to have two out of these three. Number one is irregular or dysfunctional periods. Number two is signs of too many male hormones, so acne or hair along the midline, like upper lip. And number three is cysts on the ovaries. You only need two out of these three, which means you don't even have to have cysts on your ovaries to be diagnosed with PCOS. So the name is extremely misleading. It makes us hyper focus on the ovaries, but we don't see this whole other picture of this metabolic health that's being damaged through the PCOS. And so PCOS is a fertility problem, it's a period problem, but it's also a metabolic problem. And so it impacts the entire body, the liver, the sugar, the brain, the cholesterol, everything. And so I think it should be called like, androgen ovarian syndrome or reproductive endocrinology syndrome or something like that. Anything other than PCOS would be great.
Yeah, probably coined by a man many years ago, right?
I would not be surprised.
So what are some of the typical treatments and things that we offer as healthcare providers to these patients?
Unfortunately, for oftentimes it's changing now, but for the most part, when women were diagnosed with PCOS, they would go to the doctor and they would be given birth control and they'd say, here you go, now come back when you want to get pregnant. And birth control is wonderful for controlling the menstrual cycle for women and even some of the androgen symptoms like the acne and the hair growth. But it doesn't do much for the androgen. I mean, it doesn't do anything for the metabolic part of PCOS. So you put, a 23-year-old woman on birth control for PCOS, and she does exactly what you tell her to do, and she comes back at 30, she's ready to get pregnant. Well, now she has uncontrolled insulin resistance. Maybe she's pre-diabetic. Maybe she has high cholesterol. Maybe she has fatty liver. I mean, I have a friend who had to get her uterus out before she even got to start trying. And so we've ignored this entire other side of PCOS. So the initial treatment, yes, is birth control, but we really, really need to focus on the lifestyle changes that impact metabolic health. We have medications to impact metabolic health. I love metformin, GLP-1 agonists are coming out, but there's lots of lifestyle changes that we can do, including increasing fiber, increasing protein. Unfortunately, we tell women to stop eating sugar, but what does that really mean? Do women know that a piece of white toast is the same as eating 1 teaspoon of sugar? Not really. And so we really need to have in-depth conversations when we make this diagnosis.
Yeah. And one of the challenges I had was when I first learned about lifestyle changes affecting things like PMS and PCOS, was that I didn't have time to talk about these changes in a 15-minute appointment slot, right? So that was one of the reasons I also went into this coaching field where now I spend 60 minutes with them. But talk about some of these lifestyle changes that we can do to improve the symptoms of PCOS.
So first, we have to get our patients to sleep. Okay, so I used to have a professor in med school that wore a hat. He was a pharmacy attending. He said sleep equals efficacy. If we don't get our patients to sleep, nothing works. Our hormones are going to be off, our cortisol is going to be off, we're going to have increased hunger, our mood's going to be down, everything. So we need to get our women to sleep 7 to 8 good hours. And that probably contributes to why many female healthcare workers have such a higher level of infertility. So number one is sleep. Number two is manage stress. And when I say this, I don't say get rid of your stress. You can't get rid of your stress. I believe that felt feelings move through your body, right? And stored feelings make us sick. So find ways to release stress, find ways to close the cycle of stress, find ways to move the stress out of your body. Because I'm not saying everybody needs to quit their job, and my kids are stressful, but I love them, I'm keeping them, but you have to find a way to process that. For me, it's exercising and meditation. Meditation changed my life. I was a cynic, but it's changed my life. I love to strength train, but even a walk moves the stress through your body. So managing stress, and then diet. So we don't want to say high protein. We want to say moderate protein, healthy proteins, good quality proteins, and a high fiber diet, because that's what stabilizes sugar. And then the fourth thing would be strength training, because muscle is medicine for PCOS.
Yeah. So we got sleep, stress reduction, diet, and exercise, which is exactly what I talk about all day, all long. So
Because it's science, right? You can't
yeah,
change science. Yeah.
yeah, it's not, the new term is woo woo, but it's really, it works, and I've seen it both in myself and the other ladies that I work with. Um, we don't realize how much our lifestyle habits affect things like our monthly symptoms, like our cramps and our bloating and heavy bleeding. Like I just thought heavy bleeding was normal until I learned it wasn't. And then I was like, wait, I don't have to bleed for like 7 days. I could just bleed for 2 and I'd be fine. Um, yeah, so it's a big learning curve. So I'm glad you're teaching all of this out in the world. Now you have a free guide for to improve sleep and energy. So talk a little bit about that.
Yeah. So I really believe in sleep, right? So I can, if you eat perfect 365 days a year, and you log all your macros and everything, you eat perfect, but you don't sleep, I hate to tell you this, but your hormones are probably going to still be off. And so just getting my patients to sleep is one of the best things I can do. So if you go to my Instagram and you look on my bio, I have a link to a free sleep and energy guide, because that's where everything starts. So if someone's giving you a meal plan, but they haven't asked you about your sleep, that's a no-go, right? So I think that is what I want to put out into the world, like for free, because that's what I want people to start with. I don't want people to spend thousands of dollars on a new meal plan if they're not sleeping. I want it to start with sleep.
Nice. So I will make sure to link that down below so people have easy access to it. Um, do you have any last minute tips for the woman with PCOS who's maybe this is the first time she's hearing all this stuff?
So number one, it's like 13 to 16% of the population, and 70% of women don't know that they have PCOS. So we are missing this diagnosis in 70% of women. And PCOS can cause diabetes, heart disease, depression, fatty liver, and all kinds of things. We can't be missing it in 70% of women. So if you're listening to this and this sounds like a friend or a loved one, please share it, because it can make a difference. Number two, if you get the diagnosis of PCOS and your doctor gives you the pill and says, come back when you get pregnant, you deserve a second opinion. If they're offended by your second opinion, they're the problem, not you. And number three, I talk a lot about lifestyle, but that's not to put blame on the woman. This world, our society is set up to destroy our hormones. It's not you doing it, it's being done to you. But that doesn't mean that you can't take agency over your health. Like, you are the CEO of your health. You build a good advisory board, you make good decisions, and you change your lifestyle for yourself in ways that are manageable and not disruptive to your life. Because we have far more agency over health than we realize sometimes. It takes a little bit to unlearn the reasons why we don't have that, but you do. So PCOS is a big deal. Don't let anyone tell you that it's just a period problem. And women deserve to feel better.
Yeah, I love that you're the CEO of your own health. Get the education, get the advisory board, but you make the decisions that work for you. So I
And
love
just
that.
start with the easiest thing. We've said a lot of things today. Start with the thing that is the easiest for you, because we have something called a feedback loop. Positive is an upward spiral, right? So you do something positive for your body, you'll want more positive. So choose, out of the four things I said, choose the one thing that feels the easiest to you. Do
Yeah.
that until you're comfortable, and then choose the next thing. Please don't try all four things at one time. That would be unreasonable. I wouldn't do it, and I wouldn't tell you to.
No, and I don't recommend that either. I always recommend start with one.
Yeah.
Once that gets better, you'll have the energy and the capacity to take on
Yes.
another one.
Yes.
So perfect. I love that we're so aligned in what we teach and what we
Mhm.
say. How can people connect with you if they want to follow or have a question or anything like that?
So I spend a lot of time on Instagram, anu.sidhu.md. I have a YouTube channel with longer form videos. I do have a few PCOS videos up there with my name, also Anu Sidhu MD. And then my practice website, if you're in Texas and you want to be a patient, would be www.springmonarchmd.com. And that's kind of where I hang out.
Nice. So I will put all of those links down below. So again, people can find you very easily. And please do if you're suffering with PCOS. I know it's such a common condition and it's such a debilitating one for so many people. So reach out if you need support. This was great. I loved it. Thank you so much for joining me today.
Thank you so much, Emmy, for having me.
Yeah, of course. And if something in today's episode felt like a mirror, don't ignore that. Your body, your mind, your heart, they're always communicating, and you deserve support as much as you give it. So thank you for being here, and you will hear from me again next week.
Are you struggling to be the best mom you can be? Are you fatigued, overwhelmed, and stressed out? Are you losing precious time with your family because of PMS? If so, sign up for my free gift on how to start living in tune with your monthly cycle. The link to get it is in the show notes below. Use this guide to help you start to eliminate your symptoms of PMS, increase your energy, reduce stress, and fully enjoy this incredible mom life. The way I see it, you have 3 choices. You can try to figure it all out on your own. You can do nothing and stay where you are, or you can get the customized guidance you need to thrive as a mom. The choice is yours. Thanks for listening to today's episode. I hope you learned something from these stories. If you enjoyed this show, please make sure to subscribe, rate, review, and share this podcast. It really helps this show grow. If you have a mom story you would like to share, click on the link in the description below on becoming a podcast guest. Remember, the content on this podcast is for general information only. It does not replace any medical advice given by your healthcare providers. Please check with your doctor if you have any questions about your specific condition and before starting any new diet or exercise regimen. Thank you, and you will hear from me soon.